This is a terrific day for Pennington. I think it's a great day for the state of Louisiana. Childhood obesity is a huge problem, not just here in Louisiana, but across the globe. Here in Louisiana, 1 in 5 kids have obesity. The result of our food system, the result of inadequate physical activity, not having enough PE in the schools, not having enough physical activity in daily lives, too much time on iPhones and pads. And so we've actually reached a point in our evolution as a society where we have kids that are likely to develop chronic diseases that typically wouldn't have developed until 40s and 50s and into their 60s. We now have kids who are developing type 2 diabetes. This was unheard of decades ago. We need to address those problems by, first of all, addressing the food supply. We hear a lot today about how can we improve the nutrition in our schools, nutrition in our homes, the snacks that kids are eating. How can we increase physical activity? How can we get kids more active and engaged? Grow Healthy is all about engagement, participation in physical activity programs, engagement in nutrition education. We hope that as time progresses, the lessons that are learned will be incorporated into the daily lives of these kids. And as they mature, as they go to college, as they take jobs, that they've learned good habits. In the schools, we want to see more physical activity, ideally more PE in the schools, but also we got to teach our kids how to boil an egg. We got to teach our kids how to cook, and instead of relying entirely on the takeout food culture that we have developed here in the U.S. and here in Louisiana, we need to have our kids more engaged in the kitchen, more engaged on the tracks, in the parks, and on the playing fields.
Grow Healthy benefits Louisiana residents by ensuring our wonderful research that's been done here can be translated into community action. Resources that can be used in the home, in schools, in clinics, and across communities. Pennington Biomedical is home to decades of transformative research around the prevention and treatment of childhood obesity. Through this opportunity, we have the ability to translate that research and bring it into Louisiana homes, schools, and clinics. Grow Healthy is partnering with elementary and middle schools across our state to provide access to free health and PE curriculum and education programs. Activities that can be done across the school, within the classroom, in PE classes, as well as take-home fun activities to be brought to the home. Over the next year or so, we are looking forward to reaching communities statewide. We're going to be traveling in our Healthy Moves bus across the state so we can access every corner, every region. In addition to that, we hope to expand our school health program, develop new resources for healthcare providers in the treatment of childhood obesity, as well as create some new fun tools for families to use at home.
This particular initiative, Grow Healthy, was born out of an initiative that we started here 5 years ago, which was a public service awareness campaign to educate the public about obesity as a disease. To date, obesity drives so much of the chronic disease that we have: diabetes, heart disease, liver disease, kidney disease. But we don't fully understand it as a disease. There has been a view that this is something that's under our control, that we should just push away from the table, or we should get more active and the problem will go away. If it was that simple, we would have done it a long time ago. It is not that simple. There is an underlying biology associated with obesity that we're only beginning to understand. You're starting to see that with the obesity drugs that are on the market today. They are fixing something. They are fixing the pathways that regulate what we eat and how we eat. So it's important for us to understand obesity first. And we began that PSA campaign about 5 years ago. We called it Obesity, O-B-E-C-I-T-Y. It was across the nation, on TV, on billboards, in malls and in schools across the nation. Very successful program. We came back to our legislators here in Louisiana and said, we've been doing this education campaign and it's been very successful. And they, of course, had the automatic question, well, what are you going to do about that? If that's such a big problem, what is Pennington's solution? So we came up with Grow Healthy. And Grow Healthy is built on 35 years of research experience. We have done all these successful studies here in Louisiana and across the nation that have demonstrated how physical activity improves diet, improves your cardiovascular risk factors, improves your weight. We have tons of data, but we have never implemented that data. So this is all about implementing the science and the discoveries that have gone on at Pennington here for the last 35 years, packaging them together in this Grow Healthy initiative, and taking that literally on the road with our bus to the communities. We live in a state that is quite rural. So a lot of population is in rural areas and it's hard to get to. And so having the transportation to be able to take these programs into schools across every parish in the state is a critical piece.
I'm really excited that we're translating this evidence now. So I'm a public health researcher, and we've done a lot of research in the labs at Pennington, but now we're actually going to go out and translate it and disseminate it to the community. A lot of times you see people, when they think about academics, they say, we publish our work in academic journals and it sits on a shelf. We're taking it off the shelf now and implementing it in the population. Because we have the evidence, we have the science, it's now time to act on it. Grow Healthy really came to exist from a partnership between Louisiana and Pennington. It's based on Pennington's research, and I think that's what gives it the public trust, because it's built on science that was funded by the federal government, the state government, USDA, Department of Defense. So it's really been peer reviewed by the experts and proven to be trustworthy and rigorously conducted. So we're really building on the evidence now and translating it. You never want to just put programs out there without that evidence that they work. And this is what we have here with Grow Healthy. In the very early years, in infancy and early childhood, we focus on the parents. We focus on the family to make changes, healthy changes. Then as children enter adolescence and young adulthood, then you have to change your approach, right? You have to focus more on the child or the adolescent in that regard. So it's really what we call family-based weight management. And it's been around for a while. It's based on behavioral change theory. So it's just a matter of encouraging healthy choices, but working with the family and engaging them as a partner. We don't tell them what to do. We work with them to develop a healthy action plan, so they can make changes over time. Right now, and in the future, I envision there'll be no cost for families in Louisiana to partake in Grow Healthy programs. This was funded by Pennington and funded by the state of Louisiana, and all of our materials are freely available to the public. We envision a long, healthy future for Grow Healthy. We really do. The problem of obesity has developed over the last several decades, and it will take several decades to address. It's not as though we can just kind of jump into this situation now and think that by next year we'll have it solved. So it's a long-term process. That's the way public health works. And we're excited to be taking the first step.
We're not trying something that hasn't been done before. Like I said at the start, we're building on 35 years of experience. We have already tried these programs. They have been shown to be successful. So we know we're going to be successful. Now do we have the follow-through? And engagement is all about results. If you're getting positive results, you stay engaged. If you're getting negative results, you tend to give up. We have strategies for that too. So the reinforcement, the changing of programs to adjust to individual needs. Engaging is all about personalizing and ensuring success for the individual. Our expectation is that that's an approach that will be sustainable. It's also an approach we feel is going to be scalable. We have to be able to get this program out across the state, and our longer-term goal is to take this program nationally. So the success and the lessons that we learn along the way here are going to be used to take Grow Healthy to the nation.